comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗹. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗹. I'm your host, Nicole Jacinto. Today with us on the show, we have Dr. 𝗛𝗲𝗵𝗶𝗵𝗹. She's a breast surgeon who practices, of course, in Makati Medical Center. So, good afternoon and welcome to the show, Doctor.
Hi, good afternoon, Miss Nicole. Thank you for having me for this afternoon to talk about breast cancer.
Yes, thank you for agreeing and being on the show and taking time out from your busy schedule. And I hope today that a lot of people will get more information about breast cancer. Let's use it as a platform to reach the people it should reach, or it can reach, whether or not they have breast cancer, or they're worrisome, or their friends or loved ones of those. They have friends who have it, and just to be more educated about our own bodies. Okay, so doctor, why don't we begin by, let me ask you, what is breast cancer, and like, how does it happen?
Yeah, so breast cancer, of course, is a disease of the breast, as the name implies. So it's cancer of the breast, but this is when abnormal cells of the breast, all right, grow out of control. So meaning abnormal growth. And how does it develop? All right. Syempre the breast has different structures within it. So nagsisimula yan. Usually, the more common type of breast cancer is within the ducts of the breast. So you're a female, you can relate to what I'm saying. And another structure are the lobules, where they contain the milk when patients or women do breastfeeding. But these are just the common structures where a cancer can grow within the breast, because the breast anatomically, all right, has other structures, right, like the connective tissue, the fat, all right, and even the smooth muscle. Kaya, when the temperature changes, a female experience, contraction of the breast and all that, and even the nipple.
Yes. I mean, people tend to forget.
So even a cancer can grow also.
Okay. Thank you for explaining that very thoroughly, doctor. And when you say like it's an abnormal growth, just talk about cancer in general. It's a growth that's not supposed to be there in any structure, in any part of the structure of.
Correct. Yeah, I just want to emphasize that normally talaga, the cells undergo, we call it parang cell damage repair. Okay. So, our normal cells will undergo particular, when it gets damaged, all right, the repair happens, and you call it like programmed cell death, apoptosis, and then it changes into new cells that are normal. Okay, what happened when cancer occurs is that these molecules or changes in the cell, the body cannot actually do the repair on itself, because cancers, when there is mutation within the DNA of the cells, I'm talking about a cancer at a molecular level already, but this is the main explanation, all right, why mga bukol lumalaki, all right, or tumutubo, because when the cells grow abnormally, and it gets out of control, meaning hindi siya nagpo-program cell death, and the cells are not actually able to repair themselves, nagiging out of control sila. And that's where a mutation happens. So the DNA changes that the body cannot repair. That's when nagkakabukol, all right? And then it it presents with bukol pag sa breast. And it can involve the adjacent structures, or yung sinasabi nila na, stage 0 siya, that's DCIS. It's just within the basement membrane of the ducts. And then when it involves it goes out of it already, it becomes invasive. Yun ay magiging stage 1 siya. All right? And some patients will present, nagkaroon po ako ng kulanyo sa kilikili. The nearest structure that where the breast drains are the lymph nodes sa kilikili. And minsan, we see more advanced cases at clinic. And these are the ones na affected na yung lymph node. And it starts primarily the tumor at the primary organ, which is the breast, and then spreads through the nearby structures, which are the armpit. And if we talk about stage 4, okay, eto na yung kumalat siya sa distant organ. So we call it metastasis.
Okay.
All right. Metastasis meaning if you get the root word ng meta is stable. Meta is beyond. All right. And then stasis is stable. So when it goes beyond that, so dun siya pumupunta sa ibang organs. And more commonly for breast is the bone, kasi nandito siya sa chest wall. All right. Yung drainage niya, if you look at the anatomy, meron tayong drainage, venous drainage sa likod na galing diretso or directly from the breast. And it usually involves the vertebral column or the spine. All right. So yun yung explanation why kumalat sa buto and all that. Yeah. Secondly is the lungs. Okay. Kasi ang breast is attached to the chest wall. So mas malapit ang lungs or yung pleura, the lining of the lungs. And the other organs like the liver, eto na yung talagang mas malayo na yung kalat. So the more distant, the more we think that it's disseminated or it's already spread to other organs.
Thank you, doctor. That was a great explanation, and in terms of the staging as well. Why, when you talk about different stages, that's a great way for non-medical professionals like myself to understand it. And, for the audience to understand it, why there's a stage 0, why there's a stage 1, a stage 2, and why it spreads. And then as you were saying, and please jump in anytime and correct me if I'm wrong. So our body goes through, I'll just kind of recap what you said. Our body goes through, naturally our cells will die. And then they'll
Yes, normal cell repair. We call it normal cell repair.
Okay, so there are cells in our body, and let's say the breast area, they die, then the cell will repair itself, or the body will repair the cell. But when this doesn't happen, when the body can't repair it, there's an abnormal growth. And it's also like you're mentioning DNA. Is it because like there's supposed to be this switch that tells like along with other cancers, that tells the body, hey, that's not a good cell. That's a bad cell. You're supposed to kill it also. Is it the same with you're supposed to kill that and make a good cell, but that switch is somehow turned off,
correct.
affected. Okay, so
yes, correct.
All right. Thank you, doctor. So so it's like can I ask you, in saying that, what occurs first, the abnormality or the body not being able, the DNA not being able to switch off the growth of abnormal cells?
Because it's usually the mutation already. So the changes in the cell that happens first, and then the body will try to repair it. But some of these changes, okay, the body cannot repair them. That's when the tumor starts to happen, and kaya nagkakabukol. And kaya nga the cancer or any type of cancer has this tendency to spread to other organs.
Yeah, because then the body's thinking, okay, I'm not gonna kill the cell even if it's abnormal, and it triggers that switch to let it grow. thinking that that's okay,
Yes,
that that's
yes.
is the
Yeah,
normal
yeah.
cell. Okay, thank you, doctor.
Kaya the
Um,
parang general definition of cancer is abnormal growth when it goes out of control.
Abnormal growth when it goes out of control. Okay, thank you, doctor. Thank you for that great explanation. It's so much easier for us to understand and not panic about. And also for those who have had breast cancer, I'm sure they're familiar with this. But it's good to. I hope this show is also comforting to them in knowing that
Yes, that's a
about.
main purpose.
Go ahead, doctor. Main purpose.
Yeah, yeah, that's the main purpose of it's October, and it's breast cancer awareness month. Almost every day I wear pink, to
Yes.
let my patients know that I'm one with them, not just the patients, but also with the family.
Yes, thank you, doctor. And I'm sure they're very appreciative of that, especially the ones that you've treated, no? And it must be an emotional ride and for everyone. And okay, this is not really related, but do you find that in your practice and especially here in the Philippines that are there any breast surgeons who are men? I mean, like, do you kind of do women feel more comfortable with another woman? Do females more feel more
So,
comfortable with another
we have
female?
so many yeah, we have so many surgeons who handle breast cancer also. I
Mhm.
think it doesn't matter whether you're male or female, all right,
Mm.
as long as the patients are comfortable with the doctor to
Yes,
get treated. That's what matters most. You can be a female, but sometimes patient is not comfortable with you.
yes,
It's always when you first interact with them that you develop this trust and rapport with patient. That's the start of a relationship of patient and doctor. So
yeah,
a lot of men before in the surgical world there are only mostly are male surgeons, but
male
now a lot of female became surgeons also. But
yes,
for breast surgeons, mostly are female, but we have so many male surgeons also
yes.
who handle breast cancer.
Yeah, and you're right in saying that before it was mostly men, and a lot of like older women that I know were treated by male doctors, and they were comfortable as well.
Yes,
And now there's more female surgeons and female doctors handling breast cancer in particular and breast surgery like yourself. So it really doesn't matter as long as you're comfortable with a doctor. And as you said, it develops,
correct.
the rapport develops. Okay, so before I get into like other questions that are let's get kind of back to the topic of what are the symptoms that somebody may notice, um, or the first symptoms that you may have breast cancer or something is happening there. There's an abnormal growth. It may not be cancer yet,
Mhm.
or what are the signs and the symptoms?
Yes. So usually the patients will go to us to surgeons in general. Will complain of breast lumps or we call it breast mass in medical term. And if this is also the most common breast complaint, all right, of female, even males. So they go
Yeah.
to you kasi may bukol.
Okay.
Okay, so that's one sign. And then the next one will be breast pain. Okay,
Yeah.
any unusual breast pain that's not related to menstrual cycle, they will go to you also for breast pain, which although most of the time the cancer tumors or the malignant bukol,
Mhm.
usually hindi sila painful. All right,
Oh,
because ibig sabihin hindi sila related to menstrual cycle and they just grow on their own. The other symptom that's most common also is nipple discharge.
okay.
Okay,
Nipple.
but these symptoms are in general, breast
Yeah.
symptoms that patients go to surgeons, okay, to ask whether ito bang symptoms na ho ito, cancer po ba o hindi.
Okay.
Okay, so and then the other symptoms that are less common naman that we pick up are yung skin changes. Ibig sabihin, parang nagka-rash yung skin over the breast, okay? Or parang namamaga, edema or thickening of the skin, okay? Which is also, these are some of the signs and symptoms of cancer, especially yung inflammatory type. Wala silang bukol, pero magang-maga yung breast nila, thickened yung skin. All right. The other one is inverted nipple or retracted nipple. When you say inverted nipple, usually these are terminologies. Ito yung mga inborn na mga pasyente that the nipple is inverted. So we have to differentiate it kung retracted siya. Ibig sabihin, when it's retracted, there's a buccal, that's affecting the buccal behind the nipple, that's affecting the structures anterior or in front of it. Ito naman yung mga retracted nipple. Okay. So we usually ask, dati na po ba itong nakadubog or recently lang po ba ito?
Yes.
Yes.
Sorry, doctor. I didn't mean to interrupt you.
Yeah, and then of course the last one, these are sa breast yun. The last one, some patients will present only na merong bukol sa kilikili or sa tabi the tail of the breast. And sometimes they mistaken it, baka naman hindi ito cancer kasi andito siya sa gilid or kilikili. And sometimes when we do biopsy for this bukol, turned out to be ang pinanggalingan nila is from the breast na hindi lang nakapa o kaya hindi lang, it didn't present as bukol sa breast. So ito yung mga common na complaint ng mga pasyente when they go to us.
Okay. Thank you, doctor. When it comes to inverted or retracted nipples, am I correct na assuming there's a difference between an inverted and a retracted nipple, or is it the same thing? It's just
yes.
I've seen an inverted nipple.
Yeah.
Though not now, but yes. Okay. The explanation was that when this woman breastfed, the nipple got sort of inverted. Can that happen, but it's not cancerous in your experience? Because I mean, she was cleared. And
so usually, yes, yeah. Usually, if there is like congenital anomaly, all right, these are the inverted nipple, parang nakalubog sila. Of course, some form of infection, okay, or inflammation can also retract the nipple. So kung namagayan bigla, pwedeng lumubog, nagkasugat when they were breastfeeding, which is very common sa mga babae na nag-breastfeed. Pwedeng magkasugat, and then it will form some scab, and the nipple can retract also. So these are the reasons that patients or women should go to clinicians to differentiate this from malignancy. And sabi ko nga sa mga pasyente ko, ang unang-unang hong tanong sa akin when they go to clinic na may pasyente, lagi bukol o nipple discharge man o breast pain man o changes on the breast, okay, they usually ang tanong nila, may cancer po ba ako? Or cancer po ba ito? Yeah, that's the most common. They go to you to know na wala silang cancer.
Okay. They check. And that's a good thing, right?
Yes, they check.
Okay. So maybe we can circle back to that a little bit later when it comes to how you diagnose that and how to diagnose breast cancer, like the nitty-gritty of diagnosing it. Okay, so you mentioned some of the symptoms and signs and like breast pain or bukol. Can you talk about the menstrual cycle? I feel that does not get enough airtime or even information. Like we're taught how to check for lumps in our breast, but sometimes we miss it, or we just don't bother because there's no pain. There's nothing uncomfortable there, and then sometimes you can get like suddenly a sharp stabbing pain in your breast, then you check, and then okay, there's nothing there, but maybe that will also help. It's like more everyday concerns because actually quite recently it's sort of coincidental. A friend of mine was telling me that she was getting worried because she started getting stabbing pains in her breasts. I'm like, are you sure it's not your heart? But anyway, it freaked her out even more. So I was like, okay, never mind, just go to a doctor. But can you that a little bit about the menstrual
Expound
cycle?
on that. Yes.
Yeah.
We call it, breast pain, we call it in medical term, nostalgia. Sabi
Mhm.
ko, this is the, ang sa mga symptoms ng breast, ito yung pinakamahirap i-explain to patients. Okay. Because
Yeah.
everybody can have pain. All
Yeah.
right. So what do clinicians do? You differentiate it from a pathologic pain and a physiologic pain. Okay,
Mhm.
I'm talking about halimbawa, it's really, I was mentioning if the pain is related to breast cancer or related to a menstrual cycle,
Mhm.
okay, it's usually cyclical. Okay,
Okay.
they'll feel pain at the first few days of menses, and
Mhm.
then eventually, gradually the pain goes down or even go away.
Yes.
Okay, a pain that's pathologic will always persist, but it also doesn't mean that the pathology or the disease is the breast itself.
Mhm.
Remember, ang sabi ko kanina, the breast is attached to a big muscle, dawal pectoralis, yung chest wall natin. So any trauma or any injury or strain on that big muscle, sa chest wall, can also cause pain. We have ribs also, we call
Yes.
it costochondritis.
Mhm.
So, yung mga masipag mag-gym, nagbuhat ng mabigat, okay, or history of trauma, usually yan ang magkaka-pain. But
Mhm.
the pain that's not related to any of those that I mentioned, we have to think of something else. And the best way for like lay people to
Mhm.
check their breast is usually after menses. When we talk about after menses, halimbawa October 1, all
Mhm.
right, nag-mens ka, wait for 1 week kasi yan yung talagang may mga changes sa breast. And
So wait for one
when
week,
that
not
happens
waiting at
after a week, yes, after a
after.
week of that, that's when the breast kind of go back to its normal or previous state already. I mean, physiologically.
Yes.
Okay, so kasi yung hormones, 'di ba? Tataas
Opo.
yan and then bababa yan.
Mhm.
Pag menses, mag-ovulate yan. Okay,
Oo.
and then bababa yan. So you let these changes, these menstrual changes die down first, okay?
Mhm.
And then that's when you do physical examination.
Mhm. Okay, thank you, doctor. That's so helpful because sometimes women will feel the pain during their menstrual cycle, and as you
Correct.
said, yeah, if it's cyclical, if you feel it every time that you have your menstruation, whether it's right before it or during it or a bit
Yes, or
after,
after.
most likely it's not. But of course, you can still always check with your doctor, right? And
Correct.
then, but the best time to check is about a week after after your menstruation is over, because that's when it should go back down to the normal way it is, the normal size. Or I hear a lot of women complaining about heaviness in the breast, like
Yes.
I'm gonna get my period na. My breast feel heavy.
Oo. Yeah,
Parang
very common 'yan. Oo,
ganun.
parang very tender yung breast.
Um,
'Yan ang
and then,
laging sinasabi.
or
Kasi
during,
those symptoms kasi are hormonally driven. 'Di ba pag when a woman is having her monthly period or the menstrual period, okay, there are a lot of hormonal changes, and these are the ones that really affect yung structures of the breast. And that's when they experience all these symptoms. So to like better check it is after all these physiologic changes in the body happen.
when the hormones kind of die down and it's back to your
Yeah, at a normal level already.
normal level. Yeah. Would those hormones be, can you just name a few? Like, is it estrogen that is
Yeah, both estrogen and progesterone. Of course, these are secreted by the ovaries, but we also have peripheral female hormones. And um, estrogen is usually sa ano yan, proliferation and epithelial proliferation. These are medical terms. In progesterone naman, more on the lobular development.
Mhm.
Okay, so both of these female hormones have great influence or impact on the physiologic changes that happen in the breast. Sa mga breastfeeding women, of course, prolactin.
Yeah.
Okay, siya yung regulate ng milk production. And the other one is oxycontin naman, oxycontin, all right, which is it's a stimulant naman for when the baby does the sucking, after birth. That's also one of the hormones that directly affect the breast also. But
Okay.
of course, in general, the female hormones, yung estrogen and progesterone, are the ones that are involved in breast development.
Yes. So those are the main ones. And there's other hormones that you mentioned as well. And they're released by, well, because the breasts are also part of the reproductive system. As you said, the ovaries release this, but there's other peripheral
Mhm.
hormones. So it is complex, but it doesn't have to be that complicated in our understanding of it. Thank you, doctor. You explained it in
Correct.
such a good manner, very articulate, and thank you for that. It's very thorough, very articulate. It confuses a lot of people, including myself. Like, okay, and then it's the anxiety sometimes starts in a lot of females, no, and then okay, how about those again on that thread? How about those who do not get their menstruation on a regular basis, meaning not on a monthly
Mhm.
cycle or the usual 28-day cycle, but every other month? Some of them have been diagnosed with PCOS, the others are just, it just seems to be that way, like, and they've had themselves checked out by an OBGYN and they've had tests done.
Correct.
So can we apply that to them too? Like in terms of their breast,
Yes.
you get the yes.
Mhm.
Okay.
Yes, for women with PCOS, they usually, the main symptom is they have menstrual irregularities.
Mm-hmm.
Okay, so you're correct. They don't get it every month. Okay, but some women naman, they are irregularly regular. Okay,
Yes.
so they get it every other month. Okay, I get a lot of patients, for clearance na pwede ba silang bigyan ng mga
Hormone
low
to
dose hormones, yes, to regulate the menses. Okay,
Mhm.
of course, we have to factor in a lot of the entire profile of the patient, if it's safe for them, okay, to
Yes.
have all this all this, not replacement, but regulators for
Yes.
hormonal imbalance. Okay,
Yes.
so it is not yung exogenous, we call it para exogenous na mga hormones that they take in a tablet to
Yes.
regulate their menses. Some PCOS, meron silang they take Yasmin. You'll hear all the brands for progesterone or estrogen, but as long as they don't have they're not high risk, okay,
Yes.
of having breast cancer. Of course, this is because these are also indicated for another medical
Another
problem.
condition, another
Okay, I
medical.
get patients, all right, with lumps on the breast.
Mhm.
They make sure, okay, when I see them, that these lumps are benign lumps and it's safe for
Mhm.
them to take all this hormone or pills to
Yeah.
regulate their menses. So in terms of self breast exam, they can still follow if
Mhm.
they don't have any menses. So they will follow the usual cycle that they have. If they're irregularly regular, then they do it. Of course, don't do it every other month, but they can do it any time of the month that they're not having their menses. But of course, we have precautions for taking all this, or
Yes.
all these
Mhm.
pills also.
Mhm.
That's why from like a surgical point of view, we
Mhm.
always check hormone replacement therapy ba before, all right, oral contraceptive pills ba before.
Mhm.
These are not wrong to take
Yeah.
because these are also given when indicated and when necessary. Patients with PCOS, they suffer a lot of symptoms and they'll have to administer these medications. Okay,
Mhm.
and doctors will not prescribe them if hindi sila safe.
Yeah.
Okay, so once these patients are cleared that they don't have any risk for breast cancer, they're not at the high risk population. So these are allowed for this type of conditions also.
Thank you, doctor. I do know of two people, like one, she would get her menses like every 6 months or every 5 months, no? And I don't think she ever took the hormone therapy.
Yeah.
And I don't think it really bothered her. So
Yeah.
that was
That
so
one is, of course, the specialty of OBGYN
yeah.
or
So,
our gynecologist.
yeah.
But
They also check it out.
aside from the female hormones I was talking about, there are other hormones that could affect. Also, there are, some women may have other hormonal imbalance problems. So, our gynecologists are able to determine what's causing all these changes or abnormalities in women, and it's also addressed by them, and they're given medications, appropriate for their condition.
Appropriate for their condition. Yes, thank you, doctor. And then there's also some that she hadn't gotten it for a year, and I said, well, you better go check with a doctor if that's. I mean, and then some choose, I don't want it na lang. So there are three people I'm talking about now that I know because I bring them to the doctor. I better have a check, And she said, I don't want it na lang. But those are not related to breast cancer. But in a way, it's part of the whole cycle. Like, how would you check if you don't know? Or, a lot of questions come in. And of course, sometimes we can't help but overthink the bodies and what's going on in the body, especially like if they want to have children or and also, do you find that there's a stigma? Is it still prevalent? Like, the one didn't want to take the birth control pills because she said she wasn't having sex. They were prescribed to her. And I said, well, I don't think people are going to think you're a slut. I'm using that word and it's allowed on the air. Because that was what she said. They might think, I said, well, you know what? It's nobody's business what you do with your body. And it's not about your sex life. But do you find that there's still a kind of oh, but okay, that would be with the OBGYN. But I mean, in your course, because you do have to work with them sometimes or get the patient's history, do you find that there's a stigma in that?
Yeah, a lot of women would, one of my patients actually asked me that. But, I would always tell them, it's hard to tell and point out that OCPs or oral contraceptive pills actually cause cancer. Because we don't, these are, if we do a study, like prospective study on them, epidemiologic study yan eh. So, walang papayag na pasyente na, uminom ka ng contraceptive pills, tingnan natin kung magkaka-cancer ka. You know what I mean? Yeah. So the reviews are just retrospective, yes, and the population very heterogeneous siya if you look at literature. But if we will talk to our colleagues in gynecology, the amount of hormones or oral contraceptive pills that they give is not actually that high, okay, to cause cancer.
Yes. Thank you.
So hindi naman siya, the exogenous. Of course, if a patient already has a personal history of breast cancer, don't give it.
Yes.
Yes, because that will, trigger the cancer more.
Thank you, doctor. I think that will help inform and educate a lot of the people who will watch this about being afraid to go there, because we have heard like, oh no, if you take that, you'll get cancer if you don't need it, or if you're not, if you're not trying to, take contraceptives because you don't want to have a kid, don't take it. So at least you made it clear to us. Sige, the OBGYN, and patients who come to you saying, I don't know, right? I don't know. Please check me out. The level or the dose of the hormone, they will evaluate it and say, okay.
Correct. Yeah. I think the safest way to deal with it or to approach it is if they're very scared of taking it, all right, this is I know it's another topic. They can go to gynecologist make sure, the pills that they are taking are safe
Mm-hmm.
to take, and the duration also,
Yes,
and it matters, all right, because it has cumulative effect exposure to OCP. But we cannot really tell, even if you tell of 5 years, but we don't know if these patients actually regularly took them.
yes, that's true. If you're not honest with your doctor, or sometimes they just forget, I don't know, I took it for a couple of months and then I freaked out and then this and that, then I didn't need it naman, then I took it again. So you'd have to know all those things. Thank you
Yes,
for going
it's a
off topic.
risk. It's a risk factor, but of course, if all these pills, if indicated,
Mm-hmm.
and especially for medical conditions, yeah, it's not improper to take
Yes.
them.
Thank you, doctor. And for going off topic a bit, because these questions come up when you talk about breast cancer. So at least we know we say, you've got questions, we've got answers. So I'm asking all these questions, and then, doctor, one more thing that has to do with the menstrual cycle in women who are premenopausal or going through menopause, where okay, is it is it correct to say, I'm sure you know this information, even if you say, okay, that's not my specialty. I'm sure you know it because it goes with your it comes hand in hand basically with your practice. Uh, some women, is it true that you cannot say that you are actually going through menopause unless you have not had your period for 1 year or 12 months straight? So you would still be
Yes,
considered.
correct.
Okay.
Yeah, so that's like clinical diagnosis, or there are patients naman
Mm.
who are surgically menopause. Ibig sabihin yung mga na hysterectomy.
Yes. Yes.
Okay, yeah, or absence of menses for a year, that's menopause already. Or some patients who, it's good that you mentioned that, who are, premenopausal sila, young patients, they're undergoing breast cancer treatment, and they go on menopause.
Yes.
Okay. So how do we tell that these patients are usually undergoing? We have some tests. We request for FSH and estradiol hormones to really tell whether these patients are menopausal or not. Yeah. So
Okay.
ito naman, these are objective um, diagnosis already. So clinically, yung absence of menses,
Yes.
na matagal nang wala. If you want to confirm it na talagang menopause na yung pasyente, we do this levels of hormones that they are really into menopausal status. That matters with the treatment in breast cancer, because magkaiba yung treatment that we give to younger patients and menopausal women compared with, yes, postmenopausal. Timely, that I just recently talked about, managing toxicities to breast cancer treatment, and menopause is one of them.
Okay. All right. So on that thread, okay, so with going through menopause and all that, and it's just, as you said, clinical. Oh, you haven't had it for a year. That's when the doctor, like you or the OBGYN, interviews the patient and they've tracked it, and then you're like a detective, right? What are your other symptoms? Blah 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 blah. And even to the point where, like, if they have breast pain, someone was complaining of breast pain to me. I said, you've been to the gym every and you've been lifting weights, right? I mean, I went to the gym once in a while, once upon a time, and it's like when you do these weights, your chest hurts, and then you get the lactic acid coming out. All other body parts hurt. So okay, so there we go. Not to like dismiss those who actually have pain. That's different. And also, I'm glad you mentioned it, and you did. You recently talked about toxicity. Can I ask you? Is there a certain demographic that gets in females first, that gets breast cancer, or that you've seen in your practice, or even what you've read in your studies, that gets breast cancer? That is more kind of, well, a certain demographic, like it jumps out at you that these women or females get breast cancer.
Yeah. All right. So mostly, okay, breast cancer is common. Being a female is already, a risk factor for breast cancer because we have the female hormone. So 99% of breast cancer diagnoses are female. But we also see, we recently operated on a man, okay, in
Mhm.
his 60s who had breast cancer, and they make about less than 0.5 to 1%
But
incidence
it
of
happens,
breast
right?
cancer in men. But it
Yeah.
happened. Yes, and we follow the same treatment for men, of course,
Mhm.
with modification because men are, in terms of hormones, are different.
Yes.
Uh, in terms of age or the group of population that we see, okay, that's why we start breast screening at age 40. All
Mhm.
right. So because we get the most number of breast cancer cases between 40 to 60 years old,
Okay.
female. Yeah,
Mhm.
and so these patients, that's why we start screening mammography at
Mhm.
40. Some countries will start at 45
Mhm.
because these are the period where we see a lot of breast cancer.
Okay. Thank you, doctor. And as you said, men get it too, and a lot of people are not aware of that. They may make up a small percentage of those who get it, but they get it. And how does that usually come to you or your door or a breast surgeon's door? Like how do the
Yeah,
men get there to that point?
they usually would they usually would complain of breast lump also, which usually is behind or near the nipple or the areola. Yeah, most men will complain of that, and um, because that is the, for men, that's the particular area where you have your the ducts and the I mean for I'm talking about men or male patients
Yes,
where
male
you
patient.
can really see where the tumor grows. Okay,
Mhm.
it's usually behind or the nipple or near the areola.
Mhm.
So that's when the complaint is usually they felt it when they're taking a bath.
Yeah.
Okay, our recent patient had a little wound.
Mhm.
Okay, near the nipple area, and when he palpated on when he felt her right his
Yeah.
right breast, that's when he knew that he had a small lump about 1.5 centimeters.
Very good male patient because a lot of times they'll say, no, it's just another muscle growing or something out of place because they don't realize that it can happen to men also. Thank you, doctor. Okay, how can family history or genetics impact getting breast cancer?
Yeah. So, it's a good question that you talked about, like family history.
Mm-hmm.
Uh, of course, our genes when we were born are half the, genes of our parents.
Mm-hmm.
Okay. So, if kung ano yung genes ng parents natin, that's what, what we have also. That's why you're the DNA of
Of
your
your
parent.
yeah, of
Okay,
your
but you will be surprised that hereditary breast cancer is not very common. Okay, it only makes up about 10% of all breast cancer. It's still, breast cancer still happens sporadic, meaning
Mhm.
it can happen at any interval of time. It can happen to a person without any family history of breast cancer. But more and more, we detect a lot of, gene mutations now. Okay, so if you relate it to a family background, usually if um, they have this high, penetrance genes or gene mutation like the BRCA1
Yeah.
and the BRCA2, which is the most commonly associated gene mutation for breast cancer. If we on the background, they have close degree relatives. So I'm talking about first, second, and third degree relatives with
Like a parent.
personal history of cancer, like a parent, and then you got the cancer also. That's when genetic counseling comes in. All
Mhm.
right. And we do genetic tests. And I'm happy and glad that here in the Philippines, we have access to genetic tests already.
That's
Some, some um, companies even offer
mhm.
free genetic tests for this patient. Angelina Jolie became very
I was gonna
famous
mention her.
when she
Do
got
you,
the BRCA mutation, and she underwent double mastectomy because her mom had the gene also.
and the gene, yes. And doctor, when you say BRCA1, BRCA2, sometimes people shortcut it, easier to pronounce BRCA1, BRCA2. That's
BRCA, yes,
no,
BRCA1 and 2, yes.
BRCA2. And as you said,
Yeah,
okay,
Filipinos like to shortcut.
yes. But except when it comes to some agency that you've never heard of, and there's a lot of acronyms. I'm like, that all sounds the same. I'm like, great, go
Yeah,
ahead.
BRCA1 and 2, but these are not just the two genes that have, the we call them high penetrance genes that are
Mhm.
associated with cancer. We have PALB2, check2, we have a lot of them, P10.
Mhm.
So what we do at clinic, if especially young patients, okay, less than 50 with personal history of cancer, in my clinic, automatic, I advise for genetic test.
Genetic
Yeah,
testing.
and there's a particular subtype of breast cancer also that has, benefit of knowing if they have mutations with BRCA1 and 2, and even, older patients like less the cut we stretch the threshold of 50 years old to at least 60 or 65 for those with triple negative breast cancer. And it was found out that if they have this mutation, it can actually help with the treatment for these patients.
Yes, okay. And doctor, okay, let's talk about some of those treatments. Talked about how family history can impact it. Now, when it comes to we'll just go shortly later into diagnosis because you've mentioned a lot of things that factor into it already, clinical, and just maybe some of the other the labs or imaging or things like that. But you mentioned well, genetic testing is one way of being able to in a way prevent someone from getting breast cancer. Would you say that's not an absolute statement, but if they go undergo
Yeah, it's a misconception that if you do genetic tests and then you're negative for this test, you won't have breast cancer.
okay, all right, it may not be
Yeah.
the
So that's a caution that I always tell my patients. If we get a negative test on these mutations, it doesn't mean that you will not develop breast cancer, because you can still you're female, your breasts are still there, and you can still develop it. The important or significant information that a negative test or the negative genetic test for BRCA1 and 2 and the other genes that are involved or associated with breast cancer is it means that this particular condition is not a hereditary or
it's not
not inherited.
not
Yes,
inherited, and specifically to those genes. How do you feel
correct.
about people taking measures like, okay, I've got it, and I want to get a mastectomy to prevent that, and possibly have the uterus and the ovaries removed as well. Of course, that's a decision of the patient, but you don't have to answer if you don't want to. But if you can, how do you feel about
Yeah.
that as a
All
form?
right. So even medically, like if they don't have any evidence, okay,
Mhm.
of having cancer,
Mhm.
or there's no proven genetic mutation on this on the genes that I mentioned, the high penetrance genes. Of course, it's not proper to take an organ or
Mhm.
part of the body that's not diseased.
Okay, all right. But if they
Yeah.
have,
So uh, if they have it, if mastectomy is done to patients, of course, who are affected by cancer,
okay,
some BRCA carriers, okay, they're just carriers, but they don't have cancer.
Mhm.
Yeah,
Okay.
we can actually give, we have three options for them. Some, they don't want any treatment.
Mhm.
They have the mutation. I'm not affected with cancer, although the risk it's super high, 60%, up to 45 to 60%. Some patients don't want any surgery.
Yes.
Okay, so what we do with them is at a younger age, we call it intensive or enhanced surveillance.
Mhm.
Okay, we do strict monitoring
Mhm.
if they develop cancer or not. Okay, number two, we can give medication. We call it chemo prevention. Before they even develop the cancer, we give them medication to take, all right, to lessen the risk of developing cancer. So I'm talking about patients who have mutations. The other one is we can do risk reducing surgeries.
Yes.
Okay, when I say risk reducing surgery, you have a BRCA mutation, you don't have cancer, and it is it is acceptable, all right, to do, like Angelina Jolie has no cancer, to do double mastectomy to lessen your risk of developing breast cancer. And BRCA1 and 2, if you have the mutation, the ovaries are also
Part of it.
the ovaries and the breasts are interrelated. So we have indication for this if they reach this particular age, because we can't just do it. We can't just remove the ovaries. At any
Yes.
given time, we'll have to time it. Okay, for BRCA1, at least minimum 40 years old. For 2, you can wait for at least 45 when these patients are already had achieved the premenopausal status, because of course removing the ovaries also have side effects. For the breast, for the breast we can remove them and then do reconstruction either with their own tissue or autologous flap, or we can put prosthetic implant for them.
Yes. Okay. So, doctor, some people would not even want an implant. I've heard of people, I don't even want one. And I've heard of people, of course, would want the implant or reconstructive surgery, as you said, based on getting, I guess, other muscle tissue and everything from their own bodies. When it comes to prosthetics in general, are women who have had breast surgery and put prosthetics in. Another notion I'd like to dispel or confirm: are they at higher risk for getting breast cancer? Because I've heard of victim blaming.
Yes, correct. Before there were like implants that puts them to risk of having not breast cancer, but it's a form of lymphoma. But the available to put in after cancer surgery. So it's just that we'll have to do it like the first step is you do the cancer surgery, and then the second step is you do the reconstruction or reconstruct.
Yes, doctor. And how about for people before who never had a history of cancer, and then they had for women, and then they had implants, and then they get breast cancer? Is it a higher risk because they had implants? Because that's what a lot of people ask also. Hello? Hi. Okay. Just some technical difference. We'll wait for the doctor to get back very shortly. All right. Dr. Remy, can you hear me? Okay, hi team. Hi Bernard, give me a couple minutes because Dr. Remy just finishing up a conversation. Thank you. Stay tuned for kakampi Bernard Tan. Kakampi natin yan. Hello? Hello there. Hi doctor, are you back? Hello doctor, are you back?
Yeah, hi Nicole.
Hi, okay. All right, sorry doctor. Technical difficulties. Hi Bernard, kakampitan. Just give us a couple more minutes. Thank you for allowing me. Bernard always allows me to just wrap up a conversation because he knows it's medical stuff, and kakampi natin yan. Kakampi din niya tayo kasi we're here trying to help people. Salamat Bernard. Okay, so Doctor, okay, so we've talked about that. Just one question, because a lot of are like, oh, because I've heard people say this actually to women, kasi you had a breast implant before, ganyan, 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 you want to make your boobs bigger, that's why you have cancer. How true or false is that? Of course, there are risks. And is it because it's an
Yeah.
old thing, like they used to use, now they use saline, right? Before they used to use.
Yes, yes. And now we use silicone. Some patients, when they'll undergo some more treatment, we temporarily put tissue expander first, and we put saline to expand it and time it with the treatment that they have, and then change it to silicone.
Mhm.
Okay, so usually it's an incidental finding for. Yes. No, silicone are safe to put for implant, and then because the silicone that are available now are not closely, associated with risk
Yes.
of breast cancer. And do we get patients that post surgery and then you put implant, nagkabukol sila ulit? Of course, we have to check all of those. The small little cells that are on the area of the breast, sometimes you can't really remove it 100% grossly. All right. So we monitor these patients and make sure that they're not having, we call it a local recurrence, or the cancer coming back.
And sometimes I think people have mistaken that with women who have gotten breast augmentation and then it leaked.
Mhm.
And so it's like, I know everyone's just in a panic and all that. Okay, doctor, sorry, I'll go through these very quickly. I just found that the conversation went in such interesting ways because of you. You led the discussion, and a lot more questions that I feel that a lot more questions that more people would want to ask, and the way you explained it were brought out rather than some of the standard questions. You answered pretty much a bunch of them anyway. Okay, how do you diagnose, just very quickly, aside from clinically, you take blood tests, labs? You mentioned the FSH. Is that for a cancer tumor or for a certain?
Yeah.
Okay. And you don't need
No,
to.
no, 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 no.
Oh, no?
For cancer diagnosis, it's clinical, and then you do imaging, either mammogram and ultrasound, and you do a biopsy. So either you do a needle biopsy, or for some patients that are advanced, you can do a punch biopsy, or you get a sample
Like from
with,
the.
we call it incisional biopsy. But yeah, but usually, of course, the standard approach for patients who have suspicious lump, okay, we call it core needle, to get a tissue and then sample it, and then have the pathologist, or these are the doctors who look at the tissue under the microscope and check whether the lump has cancer cells or not. A wrong notion also is that, baka ho kasi pag tinusok ninyo, lalong kumalat. That's never true.
Yeah. Yeah. No, that's a wrong note. And as you said, if you have the punch, you can just grab a piece of it, right? And biopsy it. And
Yes, yes. Especially for advanced, yung may mga ulcer na. Oo.
I also
But yeah, we also make sure that we get the correct area,
yes.
all right, that's affected. Kasi minsan namamaga and then wala pala yung bukol doon. That's when imaging actually get into play. Make sure that where the bukol is, that's where you get the correct area of suspicion.
And I also know someone who, she had a lump and then it wasn't, it was benign, but she kept worrying and worrying.
Yes.
All these checkups. She said, just
Not all lumps are cancer, ha?
It's not all
I
lumps
get
are
a lot of,
yeah.
yeah. My famous statement to my patients is, kaya kayo nagpunta sa akin para sabihin ko sa inyo na wala kayong cancer.
Oh, thank you, doctor. That's so positive, di ba? And
Yeah.
also, like, I know someone though who she just kept getting too nervous monitoring the lump, so she just said, take it out. And then I think that was okay too, because it worked out with her breast surgeon. And now she, of course, gets checkups and all of that. So it really also depends on the individual, your interaction with her
Yes.
doctor. And I'm sure there were other medical factors there that, we can't discuss her whole patient history here tonight. Sayang. I'm just kidding. Okay. Okay, doctor. How important is early detection when it comes to breast cancer? And maybe you can just mention some of the latest treatments, or if there are any or options for those who have
Yeah.
breast cancer, and
Okay.
if you'd like to give any advice on lifestyle changes.
Yes. I'll answer the first question. Yung if it's detected early, how important? It's very, very important. Okay, because the earlier that we detect it, the more options that we can give our patients. So this siguro it's very gasgas na yung an ounce of prevention is a pound of cure. It's very applicable to breast cancer.
Yes.
Okay, kapag mas maaga nating na-diagnose ang breast cancer, especially stage 0, the survival rate is almost 99%. All right, so the earlier that we detect it and give the optimal treatment for these patients, the survival rate is actually fantastic.
Parang katulad ng sinabi mo, Doc, pumunta sila sa'yo ng maaga, or kung kanino man yung OB, or how it works, do the rounds. Kasi, ang sinabi mo, nandito ako para sabihin sa'yo na wala kang cancer. Kasi yung
Yeah. The actual reason palagi when they go to doctors, to surgeons, is takot.
takot.
Diba? Dahil sa takot, kaya pumunta. May bukol eh. Yes, yeah. So, that's when you explain to them, young patients, of course, we get young patients who have breast cancer also. So, yun yung pinaka-importante, that they go to doctors to have themselves checked also, and do, regular self-breast exam also, para habang mas maliit yung bukol or the first encounter ng nipple discharge and all that, for all we know, it's just a physiologic change, just an intraductal papilloma. Usually, hindi naman yan cancer when they present with nipple discharge. So, parang wag matakot magpunta sa doctor.
Yes.
Okay, and then in terms of treatment naman, of course, surgery is still the mainstay of treatment for breast cancer. Siyempre, kailangan tanggalin the primary tumor. Some patients would need adjuvant therapy. Ang ibig kong sabihin, you give the treatment after surgery, like chemotherapy,
Radiation therapy.
or hormonal therapy, yung mga tablet that they take for yung iba 5 years, yung iba 10 years, depending on how aggressive the tumor is. And yung mga radiation also, okay, as indicated. Meron din kaming mga binibigay na chemotherapy before surgery. Okay, lalo na yung mga bukol na malalaki, okay, to downsize the tumor, and then give our options, more surgical options for patient. Hindi mastectomy, we call it breast conserving mastectomy lang. You just remove the bukol with normal tissue around it, or lumpectomy. Okay, so we call that neoadjuvant chemotherapy. So bago mag-surgery, and there are particular types of tumor, like yung I mentioned, yung triple negative, and then yung HER2 positive na mga breast cancer, naririnig nyo yan. We usually give chemotherapy first, unless sobrang liit lang ng bukol. This is because these types of breast cancer are very chemosensitive. These are good responders to chemotherapy. Natatakot sila minsan, bakit po magkikimo muna ako bago nyo ako operahan? And of course, chemotherapy is indicated for inoperable breast. They present to you, sobrang laki ng bukol, and hindi masasara kung i-operahan ka agad. So we give chemotherapy first. Yeah.
And then,
they were asking me to give a final advice for patients
who
are diagnosed with.
Is breast cancer preventable? Basically, the answer would be, we don't know. You don't know, no, because as you said,
Yes,
types can be, diba?
Yes,
Kasi
knowing
it happens sporadically.
You can prevent it if you know what to watch out, the risk factors. Okay, marami yan modifiable yung
advice.
Yes. Modifiable, these are yung lifestyle, alcohol, exposure to radiation, smoking, exposure to high levels of hormones also. And that goes to yung iba, kasi hindi nagkaanak, hindi nabuntis, early menstrual period, late menopause, ayan, low breastfeeding. Syempre, the common denominator of all this is high levels of female hormones. And most of the breast cancer types are we call them yung mga estrogen positive or progesterone positive, and that directs us with the treatment also. But wag matakot when ang advice ko when you're diagnosed with breast cancer, the first advice that I say is get treated.
Get treated,
Yeah,
exactly.
because breast cancer is a curable disease, okay, especially for early stages. And even for advanced stages, we have a lot of options and medications, to improve quality of life and prolong patients' survival.
Thank you, doctor. Is there anyone you'd like to say hi to before we're out of time? Anyone you'd like to say hi to, or any final words you have for everyone? Please do come back.
I just want to thank all our viewers, the audience. I hope they learn.
They learned from you. I'm certain they did, doctor.
Had as per we are always busy on October, but we never get tired of doing all these talks and advocacies, okay, not just against breast cancer but awareness of breast cancer. Ang sabi mo nga kanina, we only not deal with our breast cancer patients, but the population who have no breast cancer and the family of our patients and the relatives of our patients. I talked about survivorship, and I'm happy that we get, the survival of Filipino patients is getting higher, although we still get a lot of locally advanced disease. But I'm very happy that Filipinos are doing well in terms of breast cancer treatment.
Thank you, doctor. Thank you so much for being on the show. Please do come back and let's discuss more about breast cancer, breast surgery. People sometimes think, what exactly are you going to do to me? There's a lot of fear and apprehension, and it's always good to remind people and bring these things to the forefront. And you've been a great guest. I can't thank you enough. Thank you, Bernard Tan, also for waiting. Don't worry, folks. Nandyan na si kakampi Bernard Tan. Thank you, Doctor. And I know Bernard Tan fights every day for people who are sick even. So thank you very much. Thank you, Doctor, for being on the show. Please do come back. Okay, folks, that's it for this week. We'll be back next week. Healthline with Makati Med. I'm Nicole Jacinto, your host, and we've been talking to Dr. Velasco, a breast surgeon. Thank you so much. Bye-bye, folks. See you next time.
Yeah.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those